Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 49 of the Ask Dr. Angela podcast. It is good to be alive, isn't it? I try to be thankful for just the small things anymore. Waking up, having my health, having a job, the small things that really are not small things, being able to actually see, just all of these things. But anyway, I'm really excited to be here with you guys today. Thanksgiving is finally over, and we are on to Christmas. You ever feel like Thanksgiving is kind of getting the short end of the stick when it comes to the holidays? I mean, it's right in between Halloween and Christmas. I feel like we go from all of the hoopla and costumes, decorations, and festivities of Halloween right into all of a sudden having Christmas decorations sprout out of nowhere. I mean, folks had Christmas decorations out in October. I kind of feel like Thanksgiving is almost an afterthought. And I think I share it with you. Thanksgiving actually is my favorite holiday of the year, and I like it because of what it represents for me: family, good food, laughter, and just, celebrating the really important things in life. We really take some time to reflect on the history of Thanksgiving and the true story behind Thanksgiving. I don't think that a lot of us actually know that. I know the real history behind Thanksgiving. I know that my Native American friends know the real history behind Thanksgiving, but we're not going to go into that because I don't want to ruffle anybody's feathers. But anyway, what we are going to go into today is talking about our labia minora, part of our vulva. And the reason that this is coming up is I met a young lady the other day, and she was with her mom, just simply adorable. And she said to me, "Oh my gosh, Dr. Angela, I don't think that I'm normal down there." And so I said, "What do you mean you're not normal down there? Come on." And she said, "My little lips are not so little. They seem to be really large to me." And so I said to her, "Well, I've seen a vagina or two in my day. I mean, imagine that. Do you want me to take a look and let you know what I think?" And so she said, "Sure, I would love for you to take a look." And so her mom's there, and she gets changed from the waist down. I had, left the room while she changed, and then I came back in, and I said, "Okay, I'm going to take a look." I put my gloves on, and I said, "I'm just me." And she's like, "I know that it's just you. There's nobody else in the room." And I'm like, "Well, I'm just saying that so that I don't startle you. Excuse me." And so, she's on the table, and she has her legs in the stirrups, and I look at her labia, and I'm like, "What are you talking about? This is completely normal. I mean, the color is good, the size is fine." And she said, "I just think they're too big." And I ended up having a really nice inside laugh because so often I don't think that women really know what their labia majora, labia minora, vulva in general is supposed to look like. I mean, most of the time in these anatomy books, they're not real pictures of actual women. It seems to me that women just aren't talking about these things. Women aren't even talking about discharge. Most of the patients that I see have no idea that their girlfriend is also wearing panty liners to absorb discharge. But anyway, that's a whole nother conversation. So I went and grabbed one of my anatomy books in my office because, I'm a GYN, OBGYN to be exact, and I have a ton of books with pictures. And so, after I reassured her that her labia minora were completely normal, we went through a book and looked at some pictures. And I said, I got to tell you, next time that you're hanging out with your girlfriend, look at her labia minora. It might be a different color than yours. It might be shaped a little bit different. Sometimes they're longer than your labia majora. But typically, as long as, they're not painful, you're not getting chronic infections, you don't have pain after intercourse, or you're not completely embarrassed by them, there's nothing to do. I very rarely recommend that women seek plastic surgery for a labioplasty or any kind of reduction of their labia minora unless there's something chronically wrong. And in all of my years of practicing OBGYN, I've maybe seen one patient that went to have her labia altered. The other thing that I find very interesting, especially in this era of all of this pubic grooming, is for a long time, people's labia minora and majora was hiding underneath all that hair, all that pubic hair. And so folks didn't really know what their girlfriends or vaginas, vajayjays, whatever you want to call it, even looked like. It kind of reminds me of when I was a kid, we had this Shih Tzu who had this great long hair. And then in the summertime, we ended up getting Kiefer's hair cut off, and he was so bashful, so embarrassed, so ashamed because he finally was seeing what he looks like underneath all that fur. And I kind of feel like with everyone shaving these days, you're finally getting to see what your labia, both minora and majora, look like after you remove all of that hair. It's kind of like, that sign on your mirror. Objects in the mirror are larger and closer than they may appear otherwise. Having said all of those things, I would just really like to encourage women to take a look downstairs, i.e. at your vaginas. I guarantee you it's normal. If you have any questions or concerns about whether or not it's normal, go and see your OBGYN. If I'm your OBGYN, I'm happy to take a look. I've probably already seen it. And trust me, if there was something even remotely abnormal or going on with your vagina, labia minora, labia majora, I would most definitely tell you. I shoot straight from the hip. But I'd like to have women embrace their bodies. And certainly, I feel like in general, we need to do a better job about informing women about their bodies, their anatomy, what's normal, what's not normal. Specifically, since this query came from, a teenager who had obviously not seen good pictures of female anatomy in her health class. And so she came to me with this, and I was really happy that she did. So in closing on this topic, I'd just like to say, embrace you, all of you, and don't let some guy tell you that your labia minora is too long or too pronounced or too big. I mean, if we're going to be real about it, when's the last time that anybody saw a pretty penis? But again, that's a whole other conversation too. So in closing, I would like to thank you so much for tuning in to this episode of the Ask Dr. Angela podcast. If you have a question or a topic that you would like featured on the podcast, please go to www.askdrangela. That's AskDrAngela.com. You can also email me at angela@askdrangela.com. If you do go to the webpage, just click on the microphone on the right-hand side of the page and do what you do. In closing, I would like to leave you with this. Stop saying why you can't and say why you can. I saw this post the other day and it really kind of drove it home for me. It said, the only thing standing between you and your goal is the bullshit story you keep telling yourself. So let's just make it happen, people. Until next time, look better, feel better, be better. Looking forward to reconnecting with you on episode 50 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.